So the next question is depression. What is depression? So the depression is, before going to depression, we need to give an introduction, right? So introduction for the depression is so the National Mental Health Survey, according to the National Mental Health Survey that has been taken, most common mental or a psychiatric illness in India that is associated is depression. That you need to remember. And the clinical features of depression includes sadness, loss of interest, negative thoughts. What are the negative thoughts? Asocialism, evolution, anhedonia, apathy. All those things are negative thoughts or negative symptoms. Or suicide, that is also a negative thought. Lack of motivation is also again a negative thought. Decreased sleep and decreased appetite. These are the features of depression that you need to remember. And if you see these clinical features, like as I said, loss of interest, loss of motivation, sadness, suicide, suicidal thought, anhedonia, apathy, evolution, asocialism, decreased sleep, and decreased appetite, all those things are the features of depression. So, how much duration that these features should be present? Basically, these all features will be seen for all human beings in the world. Everybody will feel sometimes or sometime they will feel this kind of symptoms. Then everybody has depression, huh? No. In order to diagnose some person with depression, these features should be present more than 2 weeks. That is the duration of the criteria for the depression. That is more than 2 weeks. And there is something called Beck's triad. That is not about cardiac tamponade, that you will say that increased JVP, decreased BP, and tachycardia, all those things. That is Beck's triad for cardiac tamponade. Here Beck's triad for depression is there. That is interesting, right? The Beck's cognitive triad of hopelessness, that is the depression triad. Beck's cognitive triad of hopelessness. That is a triad for the depression, where the patient will have ideas of helplessness, ideas of hopelessness, and ideas of worthlessness. This is the triad, Beck's cognitive triad. Idea of helplessness, idea of hopelessness, and idea of worthlessness. So if this triad is present, the patient is more prone to go for suicidal thought. So this is very, very important. We are talking about the pathogenesis. Sorry. Talking about the pathogenesis, the patient will have biological theory. The depression has two theories: biological theory and psychological theory. The biological theory include dopamine, serotonin, noradrenaline, these three neurotransmitter abnormalities. Whereas the psychological theory includes the patient will present with some negative thoughts. Like I told you in the next cognitive triad, right? Lack of hopelessness, lack of helplessness, and lack of worthlessness. So this is the psychological theory. Okay, so we talk about depression introduction, depression, what is the features, and talk about the Beck's triad and the pathogenesis theory. We need to further plunge into this depression. Uh, 1 minute, 1 minute, guys. Okay, so uh, sorry for the interruption. Okay, Now depression, some more features about depression. This depression is more common in female. 80% of the general population has been affected and diagnosed with depression. Most commonly, depression is due to low serotonin, low dopamine, and low noradrenaline. That is your neurotransmitter theory. So this is commonly associated with bipolar disorder. How can you treat depression? The depression can be treated with lamotrigine, an antidepressant with mood stabilizer. What is mood stabilizer role? And what are the mood stabilizer that you know? That is an interesting question, right? The mood depressant, most commonly used mood depressant is your lithium. But lithium is contraindicated in the pregnant women. So pregnant women, you should not give lithium. So the safest drug that can be given, which is a mood stabilizer, that is lamotrigine. So pregnant woman, she is coming with some depression for 2 weeks, then you will give lamotrigine. All other general population, you will give mood stabilizer, that is lithium. But here it is the patient is having depression. Then why I need to give mood stabilizer? What is the role of mood stabilizer? I am having antidepressant drug. I can give antidepressant drugs, no? Why I need to give this antidepressant along with this? What is that? I mean your mood stabilizer. What is the role? Find it out. So basically the mood stabilizers should be combined with the antidepressant drugs, because the antidepressant drug, whenever the patient is given with some antidepressant drug, that antidepressant drug will decrease the depression. But it has been said that this decreasing case of a depression will cause a sudden change in the mood, and that causes a predisposing suicidal thought. That is very rare, but it has been studied in it has been said in the studies, but it is not oftenly seen. So we are combining with antidepressants along with mood stabilizers. That is the key point here. Depression, we are giving antidepressants along with your mood stabilizers. That is an overall depression topic. Thank you for listening. Thank you.